Hi, I'm Dennis Rubin, and welcome to this edition of Inside the Pere Fire and Rescue. Boy, do we have an incredible show for you. But let me first mention that we're at the great Lambeau Field in Green Bay, and the reason why we're here is to celebrate one of our own. Dr. Steve Stroman has received an award, a Star of Life, from the Wisconsin Ambulance Association, and that talks about his dedication and the great and incredible medical direction that he provides for our department. 24 hours a day, 7 days a week, 365 days a year. We have folks that are responding to emergency medical calls throughout our entire community. Whether you realize it or not only do we cover the city of De Pere, but our fire and EMS service also covers a portion of Ledgeview, Lawrence, and Ashwaubenon. We about double in size the amount of folks that we serve, and we couldn't do it without the great medical direction of Dr. Stephen Stroman. So with that, come along with me as we honor him and talk about the emergency medical system within our fire department. Thanks for joining us. De Pere Fire Department is an excellent agency that spends a lot of time preparing for and responding to emergency medical calls. In a typical year, our department will respond to about 2,500 emergencies, and about 1,800 of those will be medical calls that ranges from folks having heart attacks to automobile accidents to folks simply needing to be checked out and taken to the hospital. With that said, we operate a comprehensive program that includes first responder folks, emergency medical technicians, and paramedics. All of those folks operate under the license and direction of a qualified emergency medical room doctor, and in our case, that's Dr. Stephen Stroman. We're providing some information about our emergency medical response and what Dr. Stroman does for our department, and directly what he does for the citizens and visitors for the city of De Pere. He ensures that we provide scientific, evidence-based medicine on a regular, ongoing basis, and he looks at many of our runs to ensure that we're providing the best care within the protocols, the requirements, if you will, of the way that we should deliver that care. De Pere is very lucky to have someone as dedicated as Dr. Stroman and as hands-on and well involved in each and every aspect of the medical process. Not only does he ensure that we have the proper items in place for licensure, but he does hands-on oversee our training, as well as he does personally respond to medical calls. For instance, he was one of the folks that provided medical care to assist the young gentleman that was trapped in the tractor in Ledgeview. He actually was a fire captain in the Ledgeview Fire Department, Captain Jake Panzier, and the doctor oversaw his immediate medical care. Imagine that, having a medical physician on the scene of an incident emergency. The citizens and visitors of De Pere and the surrounding area, very, very lucky to have Dr. Steve on their side. Ladies and gentlemen, what a stunning night in a stunning city at a stunning venue. Yes or no? Yes. Yeah, needless to say. And boy, as you look around the room and see all the stars, it's just absolutely amazing. So thank you for allowing us to be here. I'm Dennis Rubin from De Pere. And our honoree tonight is our medical director, Dr. Stroman. Dr. Stroman does so many things for our organization. I don't think I would dare take up your time to go over all of his accomplishments, but I would say that one of the reasons why Eagle Threes is so successful, medical director, the reason why the Appleton area is so successful, also has assisted him as their medical director. We're so honored to have him. We also did an active shooter program, and of course Steve took a lead role. As we continued to look at technology, once again Dr. Steve was there and improved our operation to not have one Lucas device, but in fact two. I guess the way that I would describe Doctor is that if he were to be a bear, remember where we're at, Wisconsin folks, he would be a grizzly bear. The biggest and the baddest, not even a smirk, bear, be a grizzly bear. I would ask the group, if you would, to step towards the center, get away from the side, because it's certainly our pleasure and honor to say thank you to Dr. Stroman by asking him to accept this nomination from his department as a Star of Life with this great state of Wisconsin. Steve, congratulations. And as they're saying their thanks, this happens to be Steve week at work, so just tell him congratulations.
I'm Dan Gates. I'm one of the lieutenants with the Pere Fire Rescue. I'm also the EMS chair for Local 141, which represents Austin Straubel Airport, Bellevue Firefighters, the Pere Fire Rescue, and Green Bay Metro Fire Department. I was the individual who nominated Dr. Stroman for the Star Life Award. The reason being is many things, but the first time I met Dr. Stroman was about 3.5 years ago. I met him at Station 1 in the kitchen, and he came up to me, put his hand out, shook my hand, and said, "Hi, I'm Dr. Steve Stroman. You can call me Steve." And from right there on out, I knew what kind of guy he was. He's energetic, he's a great leader. His enthusiasm for emergency medicine and what he has to offer and bring to the table is a rare quality that you can find in somebody nowadays. And the years of experience and coming back to his roots, so to speak, and being able to work with us directly, the members of the whole Green Bay metro area, really has had a positive effect on everybody. And we really appreciate everything he's done. And we're lucky to have him around and be our EMS medical director. Thanks, Steve.
Hi, I'm Al Matzke, Assistant Chief to Pere Fire. I am so fortunate that I get to work in my hometown. I am born and bred in De Pere. My great-great-grandfather, Frank N. Smith, was the assistant engineer, which is equivalent to assistant chief, for 22 years in the city of De Pere. I started at 18 as a volunteer and was able to work for a couple years before I was fortunate enough to get hired full-time. My passion has always been EMS, and I've strived my entire career to deliver what I would consider to be the top quality EMS or the best quality that I could provide. And for me, the change in my career was when Dr. Stroman became our medical director. His hands-on approach, his expertise, his excitement, and what that he brings to the world of EMS is nothing short of a miracle for the people that live in De Pere. Our delivery of service is outstanding thanks to him. The education that he provides us is impeccable. I am so proud to know him and to be part of the organization that he is part of. And the citizens that we serve are really the direct beneficiaries of that. So thanks, Steve, for all you do. And thank your family. All the things that Steve does is selfless dedication at the cost of his personal time.
Hi, my name is Brian Thompson. I'm a captain on B shift at De Pere Fire. My shift's responsible for a lot of the EMS operations for the fire department. And I would just like to thank Dr. Steve Stroman for all of his dedicated efforts in helping us move forward. Since becoming our medical director, we have made leaps and bounds and so much progress. We're leading the county at this time with our initiatives, and they're actually following behind just because of the great great leadership of Steve. I'd also like to thank his family for giving him to us. I know his wife Patty doesn't want to be on camera, but she hates the radio, so we'll just make sure that that gets on there. But that just shows his dedication. He's always there for us. There's been times I've been on a call and I turn around and there's Dr. Stroman, and it's a nice feeling knowing you have that kind of backup. So once again, thanks Steve, congratulations on your Star of Life, and welcome to the Week of Steve.
Another role that Dr. Stroman provides is that of teacher. He takes the paramedic folks particularly aside and trains them in all the individualized skills that they will need. A paramedic can provide most of the care that you would receive in an emergency room, say over the past 10 or 15 years. There are certainly some procedures that can't be applied in the field, but if you were to go back a short while, most of what they were able to do in an emergency room setting, today's paramedics can do. Whether it's actually drilling into the bone marrow to start an intravenous drip of fluid, or providing proper drugs to be able to, for instance, restart a heart, or to use a defibrillator to pace a heartbeat. All of those can be accomplished by our paramedic staff, which most of the firefighters are, by the way, in the system. Each and every person has to go before Dr. Steve Stroman and to be certified to provide that skills on a regular, ongoing basis. Doctor will also bring in some assistants, which are usually emergency room physicians themselves, and will set up a round-robin station where the firefighters will learn new skills and demonstrate skill compliance in things like airway, intravenous injections, drug therapy, be able to operate the cardiac monitor, and so many, many, many more. He also assists our emergency medical technicians, which is a much lower standard than paramedic, have their job skills up to spec and certification as well. Interestingly enough, part of that process is, if you will, the document that guides each paramedic known as protocols, a step-by-step descriptive process that allows them to provide the patient care that's necessary based on the conditions. And by now you've figured it out, Dr. Steve also sees to it that we follow, understand, and learn all the elements of our protocols to deliver what we call advanced life support care. To give an interesting example of some of the direct services that Dr. Steve has provided for this community, let's go back to July 8th, 2015, and the time was just a little bit after 2 p.m. A response came in for a tractor that was overturned just outside of our city, but in our response district in Ledgeview off of Dickinson Road. Well, as the units began to respond, I found myself in the role of Deputy Incident Commander, the person that would help coordinate and provide direction and, if you will, command to the operations that would occur that day. Early into the event, I received a telephone call followed by a radio message from Dr. Stroman asking if his presence would be necessary. And of course, based on the level of entrapment that the person, the farmer, was involved in, it was necessary to ask Dr. Steve to respond to that event. When he arrived, he provided firsthand, direct, and comprehensive medical treatment. He was able to order some specific drugs and other items that would be needed by the patient that day to be able to sustain his life. And then the doctor provided direction as to where he should be treated at next via helicopter ambulance. Without a doubt that day, Dr. Steve Stroman, along with the firefighters and paramedics from our community and the surrounding departments of Ledgeview, Green Bay, Bellevue, and several others, certainly County Rescue was another major component of that, all of that came together to be able to save a life. That's a practical application and a practical example of exactly what a medical director does. And that day, Dr. Steve Stroman, along with many firefighters and paramedics from our community and others, distinguished themselves as being quite outstanding in what they do in delivering care to this great community. A comprehensive emergency medical services system tries to provide support back to the community that takes care of us. With that said, we had a great opportunity to assist the American Red Cross with a blood drive that was held on Heroes Day, September 11th, 2015. Dr. Steve Stroman, along with many members of our fire department and the Ledgeview Fire Department, were instrumental in getting the background information taken care of to bring many folks to the table to donate that day. In fact, we had quite a few parishioners from the Destiny Church located in De Pere. About 115 folks showed up that day, and 86 pints of blood were collected. One of the key elements was to provide blood for the firefighter that was so severely injured in the Ledgeview incident, but just a few months earlier. But also it was beyond that. It was certainly taking care of our community to make sure that the blood bank was filled so that as folks need emergency medical care or whole blood products or the ability to access any of the items that are provided from those blood products would be there, they'd be ready on the shelf, and they'd be ready to use. Dr. Stroman's leadership was outstanding that day, and in fact, as you'll see, he actually even rolled up his sleeve. So let me thank him, the American Red Cross, and all of the folks that made that day so absolutely a wonderful success for our community. Oh yes, one last thing. Doc spearheaded a group that provided a huge donation to allow the fire department to have a second Lucas device. The Lucas device takes over CPR and replaces the human element and does it to a higher degree with less stress on the emergency responder, but more importantly, it allows that responder to focus on many other aspects of providing care to someone that's in the most critical condition possible, and that, of course, is during a cardiac arrest. With Doc's help, leading with some private contributors, about $15,000 was raised to have that device on the west side of the river. Without him or his medical group, we would not be able to have that additional protection covering both sides of our city. And here's to Dr. Steve Stroman and all of his colleagues that donated money to allow us to provide the very best care possible in the great state of Wisconsin. So here's a tip of the old fire helmet for Dr. Steve and his pals. Thank you guys so very, very much for empowering us to do our job to the very best of our abilities.
So all of us here at De Pere Fire Rescue would like to thank the Baycare Clinic Foundation and its physicians for the donation for the Lucas device. We also want to thank Dr. Steve Stroman for his leadership and guidance in helping us obtain such a wonderful device. This device here is going to increase our effectiveness dramatically. By applying this to a patient, it is going to allow for this device to take over the compressions during a cardiac arrest and give life-saving measures to our patients. All right, folks, now what you're going to see is the Lucas device in a simulated unresponsive cardiac patient. You're going to see the members of here at De Pere Fire working a simulated cardiac arrest and see the Lucas device provide life-saving measures. All right. Sure. Want to look, listen, and feel, Danny? See if you got a pulse.
Not
at
breathing,
all.
I got no pulse.
Okay, go ahead and start compressions. All right. Neil, if you want to put in an oral airway and a non-rebreather at 15 liters a minute with oxygen, I'll put on the cardiac monitor and see what rhythm we're in. Ma'am, have you seen how long he has been down for? Do you know how long he's been down for approximately?
No.
Okay. Okay. Ma'am, does he have any medical history at all? Not that you're aware of? Okay. Did you just come inside and find him laying like this?
Yes, I did.
What was he doing for activities today prior to this?
Not much today.
Not much today? Okay. Has he been kind of sick lately?
He said he wasn't feeling well this morning.
Wasn't feeling well, okay. Did he complain of any chest pain at all or indigestion?
No, he did not.
Okay.
On the table there. Right on the table.
All right, so let's hold compressions. Yep, let's hold compressions. All right, we have a shockable rhythm. It's V-fib. All right, I'm going to go ahead and charge up the monitor. Okay. Okay, go ahead with compressions. All right, let's get the Lucas device on here. Neil, if you want to give me a hand with this, let's get this established so we can get compressions taken over. Put the plate underneath them.
Yep.
Slide the device up.
Get it up.
Yep.
Good.
Okay. All right. So let's secure the hand up on this side. And yep, we'll do the hand on this side. Yep, you can go ahead and start the IV right in the hand on the top there. Okay.
That yellow cord that we can. Got the yellow cord that goes around. Push the cord up.
No, it's fine. Okay. All right, let's stop for another rhythm analysis. All right, let's go ahead and pause. Neil, you want to get ready to go ahead with innovation? All right, so we're going to pause. Okay, rhythm analysis. We're still in V-fib, V-tac. We're going to go ahead and defibrillate. All right, I'm going to go ahead and charge up. Okay, we're charged. You're clear, I'm clear, we're all clear. I'm going to defibrillate. Okay, go back and resume compressions. Go ahead and intubate. I got your bag valve mask. Talk through what you're doing.
It's your vocal cords.
Okay, you got your syringe. Pull out your stylet. All right, we got fog into the tube. Yep, good end tidal. All right. Should go ahead and secure the tube. Let's get 300 milligrams of amiodarone up for our second drug regimen also.
Here's your amiodarone.
Okay. I'll take that and deliver that.
What a great job with Lieutenant Dan Gates and his crew applying this device to a simulated mannequin to continue our training skills, and of course in this case to demonstrate what those skills are to you, our viewing audience, our citizens, and the visitors of the city of De Pere. With this new equipment and the training that's provided on a regular basis, I know we'll be saving more lives out there in the community, and this Lucas device, along with all the great work and support of all of our paramedics and emergency medical technicians, will have a huge impact on the quality of life and the opportunity to have the very best medical service in one of the cities in the state of Wisconsin. Okay, ladies and gentlemen and members of De Pere Fire and Rescue, there you go. Another Inside De Pere Fire Department is complete. We truly hope that you enjoyed this story about our emergency medical service, as well as the honors that our medical director received, Dr. Steve Stroman. The Professional Ambulance Association of Wisconsin provided him with a Star of Life Award, which is one of the highest awards that can be received in emergency medical services in the great state of Wisconsin. Thank each and every one of you for joining us, and we look forward to having you back again on Inside De Pere Fire and Rescue. Thanks.